Hello medical student. Welcome to yet another rotation of colorectal surgery. Why are you late?
I am sorry, I didn't realize I was late. I thought we started at 8:30.
What did they teach you at medical school? Do you not know that in surgery we start at 4:30 a.m., so that we have nothing to do in the afternoon, and so we can look down with disdain at the lazy medics?
I am sorry, I will get up earlier tomorrow, even though the patients are not even awake yet.
Okay, where are the other 3 students on your firm?
I do not know. They are 5 years.
You must be a Jap. Are you ready for my ward round?
Yes, doctor, I have clerked this patient to present to you. I thought we could use this as a mini-kex, if we have time?
Very well, if you do a good job I will write it on the form, because I do not realize that it means nothing.
Should I tell you about him now?
Yes, go ahead. I will pretend I'm listening, while thinking of obscure questions to ask you.
The patient is a 24-year-old student presenting with central abdominal pain which has moved to his right iliac fossa. I think he has appendicitis.
Have you examined him yet?
Yes, his abdomen is tender, and he has some guarding. By the way, I think he can hear us.
I'm sure he doesn't mind us talking about him in the third person. That was okay, but next time remember to tell me if he has type 7 stool, and if he has passed wind, since that is all I'm interested in. Do you know what McBurney's point is?
Yes, it is 1/3 of the way between the acis and the umbilicus.
I did not expect you to know that. Nevertheless, I will proceed to rant about how little anatomy you are taught these days compared to when I was a medical student. What else could this patient have?
My differential includes mesenteric adenitis, Crohn's disease and colorectal cancer, because these were all cases in PBL.
What is PBL?
It's basically how we learn these days in small groups, where we teach each other medicine that we have taught ourselves.
I do not understand the concept.
We go through cases and make decisions about how to manage a patient on a computer.
Are you sure you are not making this up?
We still have some lectures to support our core curriculum. And there is also something called the spiral of learning.
Never mind. Tell me everything you know about postoperative complications.
Complications can be immediate, early or late. Immediate complications are anesthetic reactions and hemorrhage in the first 24 hours. Early complications over the first week include infections of the chest, urinary tract and the wound itself. Also DVT and ileus. Late complications are adhesions, incisional hernias and/or recurrence of the problem for which the operation was indicated.
That was okay, but since it was not the exact answer I had in my mind, I will simply ignore it and ask you increasingly harder questions until you are unable to answer, at which point I will proceed to mock you.
But how will that help with my learning?
It will not. I will simply enjoy it. Last week I made a student cry.
That must have been a difficult situation for you.
Is that a phrase you learned in PBL?
No, we are now taught communication skills. It forms 1/3 of our curriculum. How does that make you feel?
We didn't need all that crap in my day. We spent all our time in the dissecting room and didn't see a patient until our final year.
Didn't you only have class sizes of like 30 or something?
Yes, what is your point?
Well, perhaps things have changed for the better.
Are you saying that most of the knowledge we had to learn was redundant? I still know how to draw the chemical structure of an amino acid.
But how does that actually help your patients?
It is not about the patients.
I think he may have heard you.
I do not care. Soon he will be asleep. Then I can sew my initials onto his abdomen. Go get the nurse and scrub up. I bet my registrar 10 pounds that you would need 3 attempts to gown up properly. Do not disappoint me.